There are people out there who can do impressions of different people, noises, or animals, like cats for example. There are also people who make these cat noises unintentionally. These people have a disorder called Cri Du Chat syndrome. It causes them to make cat-like cries, have a deformed face, and suffer from severe retardation. Cri Du Chat translates to cry of the cat in French, and was discovered by French professor Jérôme Lejeune in France. Cri Du Chat syndrome is a mosaicism, which means two cells are genetically different. The chromosome 5p is what's different. It's been partially deleted. It's only inherited about 10% of the time. There are many symptoms of Cri Du Chat syndrome, including cat-like cry, low birth weight, small head, rounded face, flattened bridge of the nose, wide-spaced eyes, folds over the eyelids, unusually high or narrow palate, abnormally small chin, malformations in the ears, high-pitched voice, and a severe intellectual disability. The life expectancy of these people is usually the same as any other person, unless they are one of the very few people who suffer from severe organ damage that can come with this disorder. All of the people with Cri Du Chat syndrome, however, suffer with severe psychomotor retardation. This causes them to have trouble communicating, which can make them feel isolated and might make the parents feel like they've done something wrong. Doctors can use prenatal tests with microarray to see the embryo and see if it's missing chromosome 5p. There is no current treatment for Cri Du Chat syndrome itself. There is, however, treatment for the symptoms. This can include physical and speech therapy and communication and behavioral modification. The treatment for this disorder has been the same ever since it's been discovered because it wasn't discovered that long ago, and there hasn't been much research done on it. Cri Du Chat syndrome is a very poorly researched disorder. It wasn't until very recently that doctors figured out it was because of the deletion of chromosome 5p. However, clinicaltrials.gov shows multiple studies that have been done regarding this disorder. Gene therapy has not been attempted. Although it's not a deadly disorder, it still has a big impact on the patients and their families.